way forward. So that's some of the things I'll be discussing in the next couple of minutes. Okay, so what really is cerebral palsy? We know that cerebral palsy is a motor problem. When we talk about motor problem, we are talking about the things that are involved with movement and posture, the ability of somebody to move or to position himself properly. Those are the things that we talk about motor function, and that is primarily what cerebral palsy is. And this motor usually results from an injury that has occurred to the brain, and this injury has to be non-progressive. So if you are seeing an injury that is ongoing, you don't regard that as cerebral palsy. So it's an injury that has occurred to the brain, and it has affected the motor part of the brain. And that injury has to involve the brain that is still developing. Okay, so that means that it has to occur in childhood, usually in the first 5 years of life. So when an injury has affected the brain, either when the child is in the womb or in the first 5 years of life, that's when we say that this child will have developed cerebral palsy. And this cerebral palsy has to involve the motor functions of the body, the ability to move and position oneself. The cerebral palsy is not a progressive disorder. We know that it's not progressive, okay? But we know that over time it keeps on evolving as the brain matures. Okay? Because it occurs to the brain when the child is still very young. As the child is growing, it keeps evolving, but it does not progress. But we've seen parents telling us that they think that the problem is progressive. Okay? But we know that the parents are worried, and if they start seeing new manifestation, they will start thinking that it's a progressive thing. But we know that clinically, cerebral palsy is not progressive, but it usually evolves over time. Presently, we know that there is no cure for cerebral palsy. That is what orthodox medicine knows for now. Probably in the future, we may find a cure. But for now, there is no cure for cerebral palsy. Okay? And the reason why there is no cure yet is that once an injury affects the brain and those brain cells die, the brain cells do not have the ability to regenerate themselves. So because of that, once you have that death of part of the brain cells, then there's no generation, and then it becomes difficult for the problem to resolve completely. However, we know that if a child that has cerebral palsy is identified early, and then we start early intervention, then that child is going to improve dramatically, and it will attain a maximum potential, and then it may be able to go to school, or may be able to have vocational training, and then live an independent life. Okay, but presently, we know that we don't have any cure for cerebral palsy yet. So how many people do we think have cerebral palsy all over the world? We know that cerebral palsy is a common problem. And worldwide, it's reported that a rate of about 1 to 3 per 1,000 children. That is what we know, that about 1 to 3 children in 1,000 will have cerebral palsy. In the United States, when we have definite data, we know that about 764,000 children and adults currently have cerebral palsy as of 2012 in the United States. And about 2 to 3 children out of every 1,000 will have cerebral palsy. These are currently what we know in the United States. In Nigeria, we don't have a population-based studies. I know Professor Leslie has done some studies, in the community and in hospital. What we have in Nigeria are hospital and community-based studies. But we don't have population-based studies that are done by the National Population Commission that will actually tell us the number of people that are living with cerebral palsy. The only population-based study we have somewhere around us is the one that was done in South Africa that reported a very high rate of 28 per 1,000 children. And we know that South Africa has a better health indices compared to Nigeria. So even if we use their own estimates, and then we'll take a population of Nigeria of 160 million, then we should estimate that about 2 million children are living with cerebral palsy. But that's an estimate. We don't know what the exact number is. So what are the things that we know can cause cerebral palsy? There are so many things, a broad group of problems that could occur that may result in cerebral palsy. And this problem will occur either during the time of pregnancy, when the woman is pregnant, it will occur during the time of labor and delivery, and it will also occur after birth, especially in the first 5 years of life when the brain is still developing. And this problem may affect the mother, it may affect the fetus, or it may affect the child. So a problem that will affect the mother will definitely affect the fetus. And then the problem may affect the fetus directly, or it may affect the child after that child has been born. During the time of pregnancy, the problems that will affect the mother and may give rise to cerebral palsy includes infections. If a woman has infection, that may affect the fetus and then result in cerebral palsy. The choreomyelitis is when we have an infection of the membranes that usually cover the baby. When those membranes are infected, then that may also give rise to cerebral palsy. Then when the woman starts bleeding before she delivers, that may compromise blood delivery to the baby, and then that may also result in cerebral palsy. And then if a woman is abusing drugs, or if there is a trauma, maybe a woman falls or she sits on the abdomen, that may partially separate the placenta, and then we may have reduced blood supply to the baby, and that may result in cerebral palsy. Then if there's excessive X-rays, the woman is exposed to excessive X-rays, or she lives in an area where there's maybe there's a nuclear accident, and then the woman is exposed to excessive radiation, then that may also result in cerebral palsy. And then for the fetus, when there is a congenital malformation of the brain, when the brain is not well formed, that will definitely result in cerebral palsy. And then other serious malformations in the baby that will reduce oxygen delivery to the brain also give rise to that. Then if there are congenital infection and then problem with the umbilical cord, those are the things that may result in cerebral palsy when the child is still in the womb. Then during the time of labor and delivery, we know that one of the big problems that we have is the prolonged obstructed level that some women may have when they are about to deliver. If there is prolonged obstructed level, then that may result in a problem with the child. And then if there is also instrumental delivery, either delivery by forceps or by vacuum, that may have an impact on the child's brain and give rise to cerebral palsy. Then in the infants, the big problem that we see people having is severe metastasia. That's still a big problem in our environment. When a child is born and that child is not able to establish respiration, then that child is asphyxiated and may end up having cerebral palsy. Then the preterm infant is also prone to having cerebral palsy because it may not be able to establish adequate breathing after delivery. Then for multiple deliveries by twins or triplets or quadruplets, they are more prone to having cerebral palsy too. And then for some children that bleed into the brain, intracranial hemorrhage, they also prone to that. Then birth trauma, maybe during the time of delivery, there's a trauma to the child. Okay, that may result to that. Then neonatal jaundice, unfortunately, is still a big problem that we have because people don't recognize this early. And even those that recognize it do not treat it properly. Okay, even doctors, we see doctors that say a child that has jaundice and tell the mother to be taking the child to the early morning sun. And then some of them will tell you to go and get glucose water. Even those that are trained, not to talk of those that are not properly informed. So unfortunately for us, neonatal jaundice is still a big problem in our environment. And then for children that are not fed early after birth, we expect that after delivery, the child should start feeding within 30 to 60 minutes. But if a child is not fed, especially after 2 hours, then the child's glucose level may drop so low. And the brain relies on glucose for its energy supply. So if that glucose is not there, then that child will not have the glucose to power the brain, and that child may end up having cerebral palsy. And then infection like meningitis and encephalitis will also result to that. Then after that, there are a few conditions. Meningitis, that's infection of the covering of the brain. Encephalitis is infection of the brain itself. And then if a child has head injury, maybe a child has fallen from a height or is hit by a road traffic accident, then that may also result in that. Then less important. So in Nigeria, the thing that we have found to be the commonest causes of cerebral palsy are the severe metastasia. That is the leading cause of cerebral palsy in Nigeria. Okay, we found that about, there are different statistics from different centers, but it's about the most common cause of cerebral palsy in most centers in Nigeria. Then severe jaundice keeps being a problem up till now. Ideally, it should not be a problem because jaundice can be managed. But if it's not recognized and managed properly, then it may give rise to brain damage. Then prematurity and meningitis are also important causes of cerebral palsy in Nigeria. So how do we classify cerebral palsy? There are so many ways that cerebral palsy can be classified. We have the etiological classification, physiological, topographic. There are different ways, but the one that is most commonly accepted, we have two that are most commonly accepted: the international classification and the functional classification of cerebral palsy. These are the ones that are most accepted worldwide. And both of them classify cerebral palsy into 4 classes. In the international classification, we have the spastic cerebral palsy. And the spastic cerebral palsy is the case where the child body is stiff. It does have that stiffness. The stiffness may affect one side of the body, it may affect all the 4 limbs, it may affect only the 2 lower limbs. So those are the spastic types of cerebral palsy. Then we also have the accentuated cerebral palsy or the dyskinetic ones. And these ones are the ones where you're having abnormal body movements. It may be something like this, the chorea, the atetosis, and then tremors. And these are different types of accentuated cerebral palsy. Then we also have the ataxic cerebral palsy. And the ataxic cerebral palsy is the condition where the child has an unsteady gait. The child cannot sit, if he sits, he'll be shaking. Or if he's walking, he'll be staggering. Okay, and that's when the posterior part of the brain is affected in the injury. And then we have the mixed type. When you have injury that affect different parts of the brain, then it may give you a mixed type of cerebral palsy. The functional classification primarily talks about what the child is able to do and what he's not able to do. So the class 1, the child has cerebral palsy, the motor involvement, but his activity and is not limited. The child can walk, he can run, and he can do other activities. But the child still has cerebral palsy because there's motor involvement. Then the class 2 is when we have a slight to moderate limitation. This child may not be able to run, but he can walk, with a limp. And that's the class 2. And then the class 3 is when you have a moderate to great limitation. This child may not be able to walk. And then the class 5 is when there is no useful activity at all, when the child cannot use that limb at all. And that is the most severe form of cerebral palsy. So these are the different ways that we can classify cerebral palsy. So what are the signs and symptoms of cerebral palsy? There are different ways cerebral palsy can manifest. It's not the way it manifests in one child that it will manifest in another child. They all have their different ways of manifestation. But for us to say that there's cerebral palsy, there has to be involvement of the motor functions of the body, and that has to do with either posture and or movement. So one of the things that could be affected is the muscle tone. And there are different types of tone problems a child that has cerebral palsy will have. Then movement, coordination and control is also affected in cerebral palsy. Either the child cannot control his movements or he cannot coordinate his movement. Then the reflexes may also be affected. The reflexes is the ability of the person to immediately react to any immediate danger. And then the posture of the child, the balance, the fine motor function, the gross motor function, and the oral motor function. These are the different areas of the motor activity in a child that may be affected if there is cerebral palsy. So the muscle tone, you may have hypotonia. When the child is just floppy, it's just floppy, very flaccid, cannot move the limb, the limb will be very, very flaccid. And then we can also have hypertonia. Hypertonia is much more common than hypotonia.